Dr. Ungerleider, I want to start with you. We're talking about transforming the way that we talk about death, but can you talk a little bit about what it's like to die in America today?
Yeah, thanks, Jennifer. I would go as far to say that dying in America today is a public health crisis. 80% of people wish to die at home, around 30% actually do. The rest are dying in hospitals and other institutions. 60% of people are dying in pain. Our healthcare system favors aggressive, invasive treatment for people of all ages and all medical conditions, even if it won't help them. And this is very expensive care. And how it plays out for people is it creates a lot of needless suffering for patients and their families in and around the end of life. And we could be doing a whole lot more to encourage upstream conversation so that the care that people get is care that they really want, they really understand, I think truly honors the life that they've lived. So a lot of the work that we do at Endwell is trying to change that cultural conversation. We know that doctors in general really fear death. How can we allow more conversation about mortality to let us all live better every day? How can we create interdisciplinary solutions so that dying, so that caregiving, so that grief is a little less hard for people? And then the third thing that we really focus on is trying to shift media portrayal of death and dying, which we know on film and television is inaccurate, to try to include things like medical aid in dying, to tell more nuanced stories of patient-centered care around end of life, the way that things really should be. Psychedelic assisted therapy, death doulas, all the things that hopefully we'll get to talk about today. And so I know that we can be doing a lot better.
Mm-hmm. And Darnell, you are a death doula.
I am.
And when we think about doulas, we think about someone who's assisting at the birth of a child. Can you tell us a little bit about what you do?
Yeah, absolutely. Just talking about birth, everyone knows what a birth doula is. And so, as a joke, usually when people ask, I say, well, birth doulas bring them in, I take them out. Which essentially is what it is, but I'm there as a support. I'm there to make sure they get the good death, the death that they want. Everyone wants to die with dignity. I'm there to support that. There to support the families through grief, and just make sure that the person doesn't die alone. I started in this business because I didn't want people to die alone. And I get to be there, holding their hand through that process, advocating for them in the hospital, in the medical system. And a lot of my work I do in Black communities. And so advocating in the medical system is a huge part of the work. But all of that, it's a huge support system, and sometimes there is no family. So I get to be the family, I get to be the support, the advocate, and making sure that good death, or as close to that, happens.
Yeah. And Lisa, you do a little bit of work in medical aid in dying, and it's probably a topic that gets a lot of the focus of conversations around reframing death, but I'm hoping you can tell us a little bit about what it actually is and what it means, what it looks like.
Sure. So I work in hospice as a social worker, and in that space, I help people similar to Darnell. I'm part of the interdisciplinary team, and sometimes we also involve death doulas as part of that. And through my work supporting people, what I witness are these beautiful, loving deaths, and then I also witness a lot of pain and suffering and fear and anxiety about what's to come. And so in 11 regions, or 10 states and DC, medical aid in dying is legal. And what that means is a person who is terminally ill, has 6 months or less to live, is competent to make their own decisions, and can ingest the medication themselves, they are allowed to control the matter and time of their death. And I've had the privilege of attending a lot of those deaths. And what's really beautiful about those experiences is that we're all talking about the fact that the person's dying. And for me, that's what I see us lacking the most in our culture, is we're just not talking about it. And when someone talks about, even if they're exploring the option of medical aid in dying, it means we're talking about what they want in their death, what they want in their life. And a third of people who obtain the prescription, they don't even take it. And so we know that people get relief and reduction of anxiety when they just have access to the medication.
Dr. Ungerleider, you mentioned just a moment ago psychedelics, and I know that there's been a lot of innovation around the other uses for psychedelics besides recreation. Can you talk a little bit about what you're thinking this is going to bring to the end-of-life experience?
Well, I can certainly tell you what I hope will happen. I think it's important to set the stage in that currently psychedelics are not legal except for 2 states, Oregon and Colorado. We do expect sometime in the next 12 to 24 months that FDA will legalize MDMA, which is also known as ecstasy, for PTSD. But currently, only those 2 states, it's legal. But I will say that, for now 60 years, we have really solid data showing that people facing the end of their lives often, not always, but pretty often have existential distress when they become more proximate to the end of their lives. And in medicine, we don't really have good tools for helping people through that. The medicines that we do have, benzodiazepines, opiates, really blunt the senses and don't allow people to live fully until they die. And so the idea with psychedelics and what the data has shown that, for example, one treatment with a trained therapist of psilocybin, which is the active component in magic mushrooms, has a very long-lasting effect, up to 6 months, of relief of some of that dread and anxiety. Many people who've gone through this experience have said that it's the most powerful day and most meaningful experience of their lives. So there is something that happens as a result of this medicine, of the intention setting, of the integration therapy that happens afterwards, which is also a really big part of it. It's not just popping medicine and then tripping. It's much, much more, and done in a very rigorous clinical environment, at least in the clinical trials. So I think there is promise, and I hope that we, as a healthcare system, as a society, see this as something that's really important for everyone to get access to, in addition to all the other indications for mental health for which psychedelics are shown to be safe and effective. I should have also mentioned that the safety and efficacy piece are there as well for dying people.
Yeah.
Absolutely.
I'm going to look out for questions. If anyone has anything, just raise your hand and a mic will come to you. But first, Darnell, I want to ask, what is the impact of your work on the families of people who are dying? Does it impact their mental health? Does it impact their grief? What have you seen?
Yeah, absolutely. One of the first things I do when I come to a client is ask how they want to die. And this is a question most family members don't ask the person who's actively dying. So it gives them a sense of, it helps ease that question that they were afraid to ask. It lightens the grief. It doesn't get rid of the grief. We can't cure grief. Grief is going to happen, but it lightens the grief when they know, when there are questions that they had, when those questions are answered, and I'm able to help facilitate that. When I'm able to help facilitate closure on so many levels, able to help them in the talk to doctors, make advance directives, figure out who the proxy is going to be. These are things that family, a lot of times when someone is diagnosed, people don't know what they need right away. And so I'm there to say, okay, this is everything you need. And so it takes a huge weight off of their shoulder, and I don't mind. I don't mind taking that and saying, listen, this is what we have to do. When you have time, this is what we have to do. And then I'm a writer full time, and I'm able to bring that into my work as a death doula and say, listen, let's tell your story. And so then when the person dies, we have all of these things that some people don't get, in the end. I'm able to craft, this is what I wanted as a kid. These were my favorite memories. These were my best friends, whatever that is, which also comes with the death deck, which is an amazing tool that I am able to use as well with some clients. And so yeah, it helps ease that pain and the suffering for the families also.
I want to turn to the audience. Does anyone have a question? We have one right here. I would just ask that you keep your questions brief and focused, and definitely have a question in there.
Thank you. Sarita Finney with Bayer Consumer Health. This is probably best directed to Darnell, and purely selfish question for all of us with aging parents, which is probably many of us in the room. What is the best way to have the conversation about how would you like to die before it's an imminent event?
Before it's the thing, yeah. To simply, to go in, a lot of people don't, to be an effective listener, I think, we say it, but all of us, we aren't that, and to just go in and listen and ask the question. I come straight out and ask. I come into the room and I just say, how do you want to die? And, some people are a little shaky on that at first, but it will start the conversation. And, if that's the one they don't want to answer, then there may be a softer one that they'll introduce and say, well, I don't know, but this, So just go in and just say, listen, I'm here to listen. Or talk about you. Go in and say, well, this is what I want. This is how I want to die. And then as you're talking about it, they'll see, it may soften them up to the conversation as well.
That's great
Can
advice.
I add a couple things? This is one of my favorite topics, is how to have these difficult conversations. And so, we can use media, as Shoshana was saying. There are films, there are podcasts, there is some great storytelling that Darnell is even, part of, to be able to use those moments in film. My mom and I watched This Is Us, and so, after the episode where they're talking about the advance directive, I called her up, and she had a lot of thoughts. And so we have to be creative. And then I created a game called the Death Deck to help people have these conversations as well. So there's a lot of tools out there, and I think we just have to be brave and willing and less denial about the fact that we're all going to die.
Mm-hmm.
And these don't have to be like sad, scary conversations either. It can be an intense set of subjects, especially if the person is already ill. But it's really a way, if you think about it, of like getting to know your loved one better. So approach it with that kind of love and curiosity of, I want to know more about you as a person and honor you throughout your life.
Absolutely.
This is such great advice. We have another question right here.
My name is Tara Bain. I'm with the 100 Top Hospital Program. Prior to doing that, I actually practiced as a nurse and was a hospice nurse and had the privilege of being with people as they died, which it is a true privilege. I'm just curious, Darnell, how do you fit in with hospice? Like, are you totally separate? Because a lot of what you were describing is what I saw when I practiced as a hospice nurse.
Yeah.
I think it's really cool what you're doing.
Yeah.
I'm just kind of curious how that all fits
No, absolutely. I've worked not for a hospice, but I've been in hospice. There are clients who will call who are in hospice. And honestly, the work that I do, I've seen hospice workers do, hospice nurses. I've seen people who don't even know what death doulas are. I started in this work because my grandmother was a caretaker. She's never heard the term death doula, but she did everything that I've been doing. I think we've all done the work on some level, but being in a hospice, I couldn't tell you what the difference is between what I do and what so many people in the hospice in hospice do. It is an amazing thing to see. And I think, like I said, I think we've all done the work. We've all been there for someone. We've all held someone's hand. We've all held space for someone. Even just going and taking the plate over to a sick neighbor, whatever that is, I think we've all done it.
We have one more question over here.
Hi, I'm Eris Lazens with Stanford Medicine. Really important topic that you're addressing today. One of the things I've been thinking about is, knowing the loneliness epidemic that's currently, that we're all dealing with in the United States. How does that play into sort of end-of-life conversations or decision-making, knowing that often people who are at that stage are hopefully counting on family networks and others to support them through something like this? How are you kind of thinking about that challenge?
I mean, it is a huge challenge, right? We know that most, family members, younger family members, don't live anywhere near, their elders. And so thinking about I think the question is about like who will care for you in those final, days, weeks, moments of life. I don't know that we have, major solutions. I think this is something that we need to be talking about as a society, right? So how we care for people through illness and through death is how we really should be measuring ourselves as a society. We need to do better. I do think that we'd be remiss to not talk about the field of palliative care in general, such that, if someone is in the hospital, I know you know this, having a team inclusive of a social worker, a physician, a nurse, and a case manager thinking about these bigger questions about the logistics and the practicalities of care. But in reality, this is a major one. And I think, the field of death doulas, while it's been around for, probably thousands, right? Since the beginning of time, it's now called death doula. They are filling a need, filling a gap where I just lost my father this last year. As somebody who's an expert in this space, I was texting a death doula friend of mine to get advice because I myself, wasn't even as well equipped as I wanted to be caring for my father who was dying. So there are many, many gaps. Isolation and loneliness is a huge part of that conversation.
And I think we also have to just be educating people more about hospice and palliative care and end-of-life options, because hospice and palliative care do include that social worker who is skilled at finding resources and helping people with caregiving issues, enlisting the help of friends and family, referrals for death doulas when that's appropriate too. So really the education to let people know that these services are available, I think is the most important thing we can be doing.
Darnell, do you have anything to add quickly?
No, I would just like to say, I think it's very important you brought up just having those conversations, like those difficult conversations. I think that's what's gonna drive us a little bit further and really find out, yeah, we aren't that close to some people, but having those conversations, really, where do you want to be? Do you want to be here? How do you want to die? Is a great way into a lot of that. A lot of the questions you all may have can be answered by just asking that first question. How do you want to die? And just not being afraid of it, not running from it.
And I think those conversations are what give us confidence to make decisions for our family members too. Because people are really scared to make decisions on behalf of their family member. And if you have these conversations, you can feel more confident in doing so.
Thank you so much. You really are contributing to a big conversation that people are having already, but you're really working so hard to change the stigma around death, so thank you so much.
Thank you.
Thank you for being here and for this conversation.
Thank you.
Thank you.